Hello, I'm John Dillon. I'm in the nephrology division at the Mayo Clinic. Our paper is titled Long-Term Outcomes and Prognostic Factors for Patients Requiring Renal Replacement Therapy After Cardiac Surgery. This is a retrospective matched control study of patients who required dialysis after cardiac surgery. There were 202 patients. The primary findings were that, not unexpectedly, mortality was much higher among patients who required dialysis in cardiac surgery. It was 64% at 1 year versus 8% for people who did not require dialysis after cardiac surgery. The other aspect that we looked at was renal recovery. And this is something that patients and families tend to focus very heavily on. When we bring a dialysis machine into the room, a lot of times patients and families think that that's permanent. And I've always told people that it probably is not permanent, but this study gives us the data behind that in this patient group. And it turns out that only 4% of the patients that we dialyzed after cardiac surgery were still receiving dialysis 1 year later. Now, as stated previously, the mortality among this group is quite high. But among survivors, very few end up needing dialysis long-term, at least a year later. Another finding was the timing of recovery. When I was training, I was taught that if one didn't recover renal function within 30 days, that they had end-stage renal disease, and that's not true. In our study, many people recovered after 30 days, and in fact, some, about 13% or so, recovered after 90 days. So there's at least some hope for recovery for a long time. Now this data, I think, is going to be helpful to both surgeons taking care of patients requiring dialysis after cardiac surgery and the nephrologists and other medical people in terms of knowing to some extent what the prognosis is. And as we're discussing things with families, my experience is that families will focus very heavily when we get to family conferences about how they're going to get the patient to and from dialysis after discharge from the hospital. And in our these cardiac surgery patients with multi-organ system failure, as well as with probably all of the patients we see with multi-organ system failure, that usually isn't the main issue. Because we see in our data that probably long-term dialysis probably isn't going to occur. The big issue is in terms of prognosis, is mortality. And that 64% 1 year mortality that's similar to what has been seen in other studies of ICU patients with who have multi-organ system failure and require dialysis. Thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.